Anyway, this topic is heat illness, and it's actually going to be presented in three parts. Part one, we're going to define what heat illness is and discuss a little bit about treatments. And in part two, which will be next Tuesday, we will look at ways to prevent heat illness. And then in part three, 2 weeks from today, we'll discuss the heat safety plan. So I come at this from, 40 years as a chimney guy, but also as a medic in a resort town, Virginia Beach, where we see a lot of heat illness situations in summer. People that aren't used to it, go bake themselves on a beach all day, and that causes a lot of unique problems. And then we have 2 marathons a year, one in the spring and one in the fall. And again, we see a lot of heat problems. And something I'm going to talk about today that you don't usually see in a typical toolbox talk about heat illness, and that's what we call ER, or exertional rhabdomyolysis. We'll talk about that a little bit. So let's go ahead and get started. So your body has a thermoregulation system. It tries to maintain a normal temperature of about 98.6 degrees Fahrenheit. Part of this process is shivering when you're cold to generate heat, and sweating when it's hot to cool your skin. We'll talk more about that. But plan A for your body's heat regulation or heat management is dilation of your blood vessels near the surface of the skin. That's what causes a red appearance on your skin, and it moves blood to the surface of the skin to relieve heat. And then sweating is your second mechanism for cooling the body. And we're going to talk about all of these things and how they work. So plan A is dilation of veins and arteries in the skin to radiate heat out of your body. And this works pretty well until the outdoor temperature gets above body temperature. So in other words, about 98, 99 degrees. When it's above that temperature, the heat can't flow from your body to the ambient air very easily. Okay? So the body is diluting the arteries and veins, sending it to the skin level, skin surface, superficial layers of skin. But that also causes another problem, because it can reduce blood flow to other important areas, primarily your brain, and also muscles. And so if you're working out, your muscles aren't getting enough blood, so you're going to feel weak and tired a little sooner than you would have otherwise. And we're getting some background noise. Okay. All right, so plan B for heat regulation is sweating. And sweating cools the body as water evaporates off of the skin. Okay? And that process works pretty well until the humidity level increases. Got some background there. Okay, so high humidity decreases evaporation and reduces the effectiveness of the sweating mechanism. Okay, and then sweating stops as your body runs low on fluid, i.e., dehydration. So um, it's a good process, but it can't work if you don't have fluid coming in. You've got to maintain your fluid intake. That's very important. And just keep in mind that all the sweating can lead to some slipperiness that can be a factor when you're climbing ladders, when you're handling tools, things like that. Be cautious about that. Okay, so what is heat illness? And it's a disorder of the body related to exposure to heat. And it manifests in a lot of different ways. We're going to talk about dehydration, heat rash, heat cramps, heat exhaustion, heat stroke, and exertional rhabdomyolysis. So dehydration simply is your fluid out exceeds fluid in. You're not drinking enough on a hot day when you're sweating. Okay, so sweating is the primary cause of dehydration, but other causes can be sickness or illness that causes vomiting, diarrhea, things like that, possibly COVID-19, since that's what we're dealing with now. But in our setting of technicians working, the primary cause of dehydration is sweating when you're working in the heat. And symptoms of that include fatigue, uh, weakness, dry mouth and thirst, infrequent urination, dark colored urine, and severe symptoms can include nausea, dizziness, or confusion, as well as hot, dry skin as it progresses. So the treatment for dehydration is fluid and salt replacement. And you can use sports drinks like Gatorade or other similar products. They have certain electrolytes in them to help you maintain a proper balance, but you shouldn't overdo the sports drinks. You can actually drink too many of those. So if you like the Gatorade, I would say drink one of those, and then your next bottle ought to be just water. So alternate the sports drink with water. Don't overdo it. And salt tablets are not generally recommended, but salty snacks are good. One of my favorites, I keep little bags of peanuts in my truck. Uh, you can leave them laying up on the dash and they don't melt or anything like that. But they're a good, gentle source of salt replacement for your body. But any type of salty snacks, even chips or something, is good in that heat. Okay, the next thing we want to talk about is heat rash. And heat rash can occur after periods of heavy sweating. And it's simply caused by blocked sweat glands, and it appears as a skin rash and possibly with itching and tingling. It's an uncomfortable situation, but it's not a real serious complication. And the treatment for it is to wash the affected area with soap and water. And then some folks recommend applying aloe or calamine lotion. That's a little bit controversial, but the aloe seems to be beneficial. You might watch another seminar like this and they say, oh, don't put anything on it. But something gentle is going to soothe the skin and be be helpful. And heat cramps begin in the muscles when the muscle tissue is running low on electrolytes and salt due to dehydration, and it's commonly affects the legs and the arms and the abdomen, and it can be quite painful. But they're localized cramps that will affect your muscles, and it can actually be caused by drinking too much water without salt or electrolyte replacement. Um, and it's probably the first sign that you're exposing yourself to risk from rhabdomyolysis, which is a muscle problem we'll talk about a little later. So treat heat cramps with rest, water, some salty snacks to get some salt back in your body, and massage the cramp muscles. But it's an early warning sign that your body's not getting what it needs to stay healthy, and you should take notice and treat it. So heat exhaustion, when we get to this point, we're starting to get to some pretty serious stuff. And heat exhaustion is caused by an excessive loss of water, salt, and electrolytes in the body. And the symptoms of it look like thirst, excessive sweating, pale skin, tachycardia, which is a fast heart rate. We would define that as a heart rate above 100. Fatigue, weakness, nausea, vomiting, headache, blurred vision, and syncope, which means you just passed out. So all of these are signs of heat exhaustion, and they're definitely warning signs that you're getting close to a dangerous area. If you pass out on the rooftop, that's a problem, and we've seen that in EMS with roofers. You get the new guy on the crew who's, trying to show off to the boss and impress him and say, hey, I'm a great employee. And he just stays up there too long and, passes out. And then that's a problem. Or even just having blurred vision on the rooftop, that's a problem. So pay attention to what your body's telling you and don't try and push through it. Okay. So treatment for heat exhaustion is rest in a cool, shady area, possibly in your truck with the AC running, but rest and definitely fluids. And, if they're exhibiting any signs of confusion, nausea, any of the more severe signs, I would start some active cooling, spritz them with water, or even slightly with a garden hose, a fan to blow air on them. And certainly keep an eye on these people, monitor these people, don't let them be alone. So somebody is there and watching for more serious conditions to develop. And then heat stroke is, by the time you get here, this is real serious. Heat stroke is a serious, life-threatening condition, and basically Plan A and Plan B for your body has failed. We can't sweat it out. We can't dilate our blood vessels anymore. And one of the hallmarks of heat stroke is hot, dry skin. Basically, for Plan B, for sweating, your body doesn't have any more to give. You're going to develop headaches, dizziness, weak and rapid pulses, shortness of breath. Your skin will be hot, dry, and red. Body temperature approaching 103, 104 degrees. And this can advance to altered mental status, which an altered mental status is you don't know what's going on, you're confused, you're not making good decisions, you're just not yourself. And then the next step is, you pass out and you're unconscious. And, if any of these things are going on, while you're high up on the scaffolding or up on the rooftops, all of that's a bad day. And treatment, definitely call 911. This is a serious condition and is probably going to need some emergency interventions, IV fluids, for example, active cooling, but move them to a cool area, and air conditioning is preferred. Give them water if they're able to swallow, if they're still alert enough to drink. One of the tests we do is ask the patient to stick out their tongue. If they can't stick out their tongue, they can't control their airway, and they shouldn't be given any food or fluids. So remove heavy clothing if they're wearing, coveralls, Tyveks, anything like that that's going to slow the body's ability to cool off. And begin active cooling with fans, water, and ice. Put ice in the armpits, the groin, and around the neck. And if it's serious, we even immerse them in cool water or ice if it's available. But definitely you need to be monitoring these people. At the marathons that we do in the spring and the summer here in Virginia Beach, at the medical stations, we also always have little kiddie pools, the little plastic kiddie pools you can buy at Walmart. We have a couple of those just filled with ice, and if somebody's in serious condition, we pop them right in the ice bath. So this is serious stuff. Don't ignore it. Call 911. So what's the difference between exhaustion and heat stroke? And the primary difference in heat stroke, the body has run out of options for thermal regulation and needs help. The conditions have exceeded the body's ability to cool off through the skin. The sweating process has stopped, and that's one of the keys. If they're hot and dry, that's bad. If they're hot and wet, that's bad, but not as bad. When they're dry, they're well advanced and they need medical intervention. So let that be a clue. But hopefully you don't want it to get that far. You want to stop this before it gets that far. And next week we're going to talk about prevention and have some interesting stuff to share with you there. And then one thing that I want to mention, and we see this in the marathons, is called ER, or exertional rhabdomyolysis. And it can occur after intense periods of exertion, especially if the individual isn't acclimated for it. The military sees it in boot camp, where you get guys that, just aren't prepared for the level of exertion they're exposed to. New runners and CrossFitters can experience it. People that aren't conditioned for the exertion. And it starts as severe muscle pain, swelling, cramps, fatigue, and can lead to basically conscious seizures where it looks like the person is seizing, but a traditional person that's having a seizure isn't conscious. These people can talk to you, but it looks like they're seizing. And that's a severe condition in the muscles. Basically, the muscles are breaking down and polluting your blood. They're exerting toxins into your bloodstream, and it can cause muscle damage and renal failure, which is failure of your kidneys. And if you observe it, they're going to have a dark cola-like urine. And treatment for this is definitely call 911. The only way to properly diagnose this is through blood tests. Treatment requires IV therapy and possibly dialysis, which can only be done in a hospital environment. So that's a real serious manifestation of heat illness. So that brings us to the end of part 1. And then in part 2, next week, we'll discuss ways to prevent heat illness. And in part 3, we'll discuss a heat plan so that at the company level, you can be proactive and know what steps to take to protect your employees based on the weather forecast. So I think you'll find that interesting as well. As always, there's my contact information, and I always glad to talk about safety. I've unmuted now so that if anybody has any questions, we can take those. So any of you folks that are watching have any questions, I appreciate you coming today, and hope you enjoyed and found this helpful.